Q1. During which phase of the cardiac cycle are all four heart valves closed? The correct answer is option B, isovolumetric contraction. During this phase, the ventricles contract while all valves remain closed, so ventricular volume does not change. Q2. A patient's heart rate is 75 beats per minute and stroke volume is 80 milliliters. What is the cardiac output? The correct answer is option C, 6 L per minute. Cardiac output equals heart rate multiplied by stroke volume. 75 times 80 gives 6,000 milliliters, or 6 L per minute. Q3. According to the Frank-Starling mechanism, what happens when ventricular end diastolic volume increases? The correct answer is option B, increased force of contraction. Greater ventricular filling stretches the cardiac muscle fibers, allowing the heart to contract more forcefully. Q4. Which part of the ECG represents ventricular depolarization? The correct answer is option C, the QRS complex. The QRS complex represents the electrical depolarization of the ventricles. Q5. What is the major physiological function of the AV nodal delay? The correct answer is option B, to allow time for ventricular filling. The AV node slows the impulse, giving the atria time to empty blood into the ventricles before ventricular contraction. Q6. Which structure normally acts as the primary pacemaker of the heart? The correct answer is option D, the SA node. The SA node has the fastest spontaneous depolarization rate and normally sets the heart's rhythm. Q7. Which variable has the greatest influence on systemic vascular resistance? The correct answer is option C, vessel radius. Even a small change in vessel radius can produce a large change in resistance, making arteriolar diameter a major regulator of blood pressure. Q8. What happens when arterial blood pressure suddenly falls? The correct answer is option C, increased sympathetic activity. A fall in blood pressure decreases baroreceptor firing, increasing sympathetic activity and causing increased heart rate, contractility, and vasoconstriction. Q9. Most coronary blood flow to the left ventricular myocardium occurs during which phase? The correct answer is option B, ventricular diastole. During systole, contraction of the left ventricle compresses coronary vessels. Therefore, most left ventricular coronary perfusion occurs during diastole. Q10. Which ion is primarily responsible for the plateau phase of the ventricular action potential? The correct answer is option C, calcium. During the plateau phase, calcium enters cardiac muscle cells through L-type calcium channels, helping maintain the prolonged action potential. Q11. Preload is most closely related to which parameter? The correct answer is option A, ventricular end diastolic volume. Preload represents ventricular muscle stretch at the end of diastole and is commonly estimated by end diastolic volume. Q12. In a patient with systemic hypertension, which cardiac parameter is primarily increased? The correct answer is option B, afterload. Hypertension increases the pressure against which the left ventricle must pump, increasing ventricular afterload. Q13. A patient has an end diastolic volume of 150 milliliters and an end systolic volume of 60 milliliters. What is the ejection fraction? The correct answer is option C, 60%. Stroke volume is 150 minus 60, which equals 90 milliliters. Then 90 divided by 150 gives an ejection fraction of 60%. Q14. What primarily causes the first heart sound, or S1? The correct answer is option C, closure of the AV valves. S1 occurs at the beginning of ventricular systole when the mitral and tricuspid valves close. Q15. What produces the second heart sound, or S2? The correct answer is option B, closure of the aortic and pulmonary valves. S2 occurs at the end of ventricular systole when the semilunar valves close. Q16. Which vessels are considered the major resistance vessels of the circulation? The correct answer is option C, arterioles. Arterioles contain significant smooth muscle and can change their diameter, making them the main regulators of systemic vascular resistance. Q17. Which factor normally increases venous return to the heart? The correct answer is option A, skeletal muscle contraction. When skeletal muscles contract, they compress nearby veins and push blood toward the heart. This is called the skeletal muscle pump. Q18. Renin ultimately contributes to an increase in blood pressure primarily through the formation of which substance? The correct answer is option B, angiotensin II. Angiotensin II causes vasoconstriction and promotes aldosterone secretion, both of which help increase blood pressure. Q19. Which structure conducts the cardiac impulse most rapidly? The correct answer is option C, Purkinje fibers. Purkinje fibers have very high conduction velocity, allowing rapid and coordinated activation of the ventricles. Q20. What is the most common underlying mechanism responsible for myocardial infarction? The correct answer is option B, atherosclerotic plaque rupture with thrombosis. When an unstable coronary plaque ruptures, a thrombus can form and block coronary blood flow, causing myocardial ischemia and infarction.